Now that every day we don't have vaccine in people's arms, people are getting sick and dying. And so I think every effort must be made to do that. And, the team is behind him in every way they can to help make it a reality.
Michael, on this broadcast before, you praised the efforts of Operation Warp Speed in getting us a vaccine, but you were very concerned about the last stretch. Why are we having so much trouble in distributing this vaccine?
Well, Anthony, as you said, I've been very concerned for some time, and actually for over many weeks have been saying this last mile and this last inch was going to be a real problem. The last mile, meaning getting the vaccine to the populations that are at highest risk, first of all, long-term care facilities and hospitals, healthcare centers. Right now, we have had a real challenge getting vaccine into long-term care facilities because the two private pharmacy companies that had the contract with the Trump administration to do that have been very slow in getting it done. Second of all, in the healthcare setting, it's been a challenge because many of these hospitals right now themselves are overrun with the cases of COVID-19, and it's very hard to be able to coordinate both getting vaccine into these healthcare workers at the same time they're working 16-hour shifts day after day. But that's coming, and it's getting done. And now what we need to do is once we get those two done, we need to then get to the other high-risk populations. Age is clearly a critical one. You're seeing some states right now, they're already targeting those over 75. We'll move next to 65. If we cover those groups right there, we will start to really have an impact on the number of serious illnesses and deaths.
We saw earlier in this broadcast Charlie D'Agata from London reporting from a racetrack where the British are putting vaccines in a huge number of people. Do we need to make that kind of an effort?
We will make that kind of effort. First of all, state and local health departments, which really are the air traffic control towers in each state for moving these vaccines into the right populations at the right time, really have not been engaged in a way that they will be with the new Biden effort. They have not yet received support from the federal government to even roll out these vaccines. And so in that regard, it's been a real challenge trying to hire vaccinators, the kind of programs where you actually get people registered efficiently. They know when to go, where to go, and how to go to get their vaccine. I think you're going to see that all changing in the days ahead. And all I can say is we have to change it because, again, just in the time that we're doing this interview, think, 10 to 20 people in this country will have died from COVID. That's what we're up against right now.
Michael, how soon do you expect the vaccine will be widely available in this country?
Well, we're going to start seeing it ramp up every day. If we get a third vaccine, which may be approved in the next month or so, by the end of the second quarter, we could have an abundance of vaccine. But then let me just say the last piece of that last mile, last inch is getting people convinced they need it. We're still seeing pockets of great resistance to getting the vaccine hesitancy. Again, this administration has not done nearly enough to help educate people about what these vaccines are, how safe they are, what they can do, and the fact that they can not only save your life, but the life of a loved one.
Sure can. Michael Osterholm, thank you so much for being with us again.